nice and cold. It feels like home from home here, and I just love seeing all these beautiful buildings you brought. It's just marvellous. And thank you very much. So I'm going to talk about palliative care. I have to give you a bit of a warning. I've got a few slides that are actually not very happy, but I think I want to tell you something that's really, really important for you and your families, in case you need it. But anyway, we'll start off just now. Here we go, is this it? So it's a holistic approach. Very briefly, this is the founder of the hospice movement in the world. She started life as a nurse. She was tall, like me. She had back problems. She then became a social worker. And while she was a social worker, she met a patient, a Polish refugee, in 1948. And he said to her, "I want what is in your head and in your heart." And she shared her vision in 1948 of creating a hospice. And he said, "I will be a window in your home." And he left her £500, which in those days was a lot of money, to be the foundation for St Christopher's Hospice. And St Christopher's is the first hospice of its kind in the world. A marvellous place, really, really wonderful. She then became a doctor, and she qualified at the age of 39. So she was a remarkable lady, and she had this vision, and she was determined she was going to set up this hospice. And education was very much her thing, and I was very, very blessed. I was able to work at St Christopher's Hospice, and also did the course there when I went to learn how to be a palliative care nurse. And then, she was the patron of Cancer Relief India. Her concept, she had this brilliant concept, which I think is really, really helpful. And it's total pain. And if you see, the 4 circles are overlapping. And I'm going to tell you a little story to help you identify total pain. And it's something which actually I did as my university, as my degree. I did a degree in theology, spirituality and health at Durham University. And my degree was on total pain and its relevance in the Indian context. So we'll just start. So Dame Cicely Saunders said, "You are important because you're you. It doesn't matter if you're Mr. Modi or you're a rickshaw puller or whatever you are important because you are made in God's image. We will do everything possible, not only to help you to die peacefully, but to live until the last moment of your life." And that's really what I want to major on today. How we get people to live to the last moment of their life, where that is possible. So Rajiv, I dedicate all my sessions to this bicycle rickshaw puller from Ahmedabad. And Ahmedabad was one of the first places that I went to in 1989. And this picture was taken in 1989. And it has moved many, many doctors in particular, but nurses, to really change or expand their vision from being an oncologist and working in the cancer field to including palliative care. And one of the first people to become the Indian Association of Palliative Care presidents was a Dr. Firuza Patel, a brilliant doctor from Chandigarh, who was a radiation oncologist. And she actually wept when she saw this picture and she heard about the man's story. And every time when I see her, she reminds me of the story. So I think it's important to remember and to honour our patients, because our patients are our best teachers. And they've brought huge joy and insight to my life. So Rajiv has total pain. He has the physical pain, social, emotional, and spiritual pain. So he's a rickshaw puller. Could we have these lights off, do you think? Is that all right? Could we have these top lights off? It might show better. He's a rickshaw puller, and I've seen them. I don't think you have them here. Aberdeen, but certainly in Siliguri I've seen them. So can you imagine somebody who's very ill trying to cycle, look after somebody like me who's, I don't know, 75, 76 kg, and maybe a couple of other people next to me, and they've got a life-threatening illness like cancer, which is eating away at them. So this is his story. He's a 42-year-old rickshaw puller. Cancer of the mandibles, this part of the face. It's fungating, which means it looks rather like goby. It smells. It has maggots crawling out of the wound. And when he takes the food into his mouth, it comes out of the side of his mouth, because there's a great big hole here. So he has hunger. And if you have hunger, you can't feed your wife and 4 children, because you can't pull your rickshaw. And if you can't pull your rickshaw, you can't buy the food for them or pay for the children's education. There was no pain relief at that time and no morphine. I'm going to talk a bit about morphine. I'm not going to give you anything technical except to say it is a wonderful drug, and used properly it does not cause addiction, and used for people who need it because to treat the pain of their terminal illness, they do not become addicted and they do not die of using morphine. They just die comfortably. But I really want to get this over. I don't know in my audience if the general public are here or it's professionals or whatever, but whoever it is, I want to dispel these myths that if you take morphine, it kills you. Actually, if you take morphine, it enables you to go to your daughter's wedding. It enables you to hold your first grandchild, because you become pain-free. And it frees you up to live the life that you have left. So that's one message that I want to leave with you. So no work, no money to feed the family, no money to pay for treatment. He needs our compassionate and competent palliative care. So 36 years later, after this picture was taken, have things improved? Well, yes, of course they have, and I'm going to tell you some very positive stories. But I'm going to tell you, I'm afraid to tell you, I'm sad to tell you, something that actually isn't so good. So 36 years later, we've had many advances in technology, and that's great, isn't it? We've got mobile phones now, we can, all sorts of things that help us in our health and in our cooking in the kitchen and all sorts of things that help us. And that's great. That is great, so long as those things are used for the right purpose. There are many hospitals in India offering excellent ICU treatment, intensive care unit treatment. The intensive care is needed for acute events. So, for instance, if we have a car accident on the way home, we may get admitted to the intensive care unit in order to save our lives. Great. I'm happy to go in if that happens. Or post-operatively, let's say I have major heart surgery and I need to recover in the intensive care unit and I need to be ventilated. Fine, I accept it. Or if I have a sudden heart attack and I'm resuscitated and I need, again, the help of a ventilator, I have no problems with that. And I might, during that time, certainly in the Indian setting, have to be separated from my family. But the hope is that I'm going to soon see my family when I'm better. The problem is that the intensive care unit is not the place for someone who is in the process of dying at the end of their life. People think that this is the best place to be. Please, 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 let me assure you, it is not. Not if you are dying. I have seen, I'm going to tell you a story now, a true story, people who are in the act of dying and they are sent to the intensive care unit. They have a horrible, great, big, thick tube put down their throat. They are tied to the bed. They have tubes going in every orifice. Their families have to sit outside for 23 hours a day. And so the grandmother, who, has her grandchildren who are grown up and want to sit with her, are not allowed. They're not allowed in. Nobody can say their goodbyes. And while this is happening, lakhs of rupees are making the hospital rich. Lakhs. I've seen people have to sell their home, sell everything, to pay for treatment that is completely futile. And as you can tell, I feel very, very strongly about this. Very strongly, because I've seen the new suffering, where people think that the intensive care is going to make it all right. If you have a life-threatening terminal illness, it is not going to make it all right. It's going to make life worse. So I'm going to share a sad but very common story, and this is a true story about Mrs. Rastogi, a mother of a doctor, Anil Rastogi, a cardiac intensivist, and his urgent advice, he'll give you a message at the end of this story, he will, to other patients, families, and doctors. So Mrs. Rastogi was an 81-year-old mother. She had a stroke, and she had a spinal fracture, a fracture in her back. She was in hospital for 3 weeks. She then had a cardiac arrest. She had a cardiac arrest, went into a coma, and was ventilated, put on a machine, separated from her family, 81 years old. Eventually, she was taken off the machine. She was able to breathe without this horrible machine. Beep, 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 beep. Looking up at the sky, you don't know if it's midnight or midday, because the lights are on 24 hours a day. You don't know, you're completely confused. It's horrible. It is horrible. So the family decided not to re-intubate her, not to put the tube in, and written permission was given that should she die, she would not be resuscitated. However, during the night she died, and somebody wanted to bring her back to life, so she was resuscitated. Put onto the machine, again, this horrible tube, an old, lovely, gentle lady being pushed down her throat. As you can imagine, the family were distressed because they could see their mother through the glass, and they could do nothing. It's like a horror movie. It's worse than a horror movie, actually. Would you want this for your mother? To be tied up like this, with string? Tied up, with string? This lady was conscious. She couldn't scratch her nose. She couldn't do anything. She could speak. She had no need to be in intensive care at all. And she was tied up. This is barbaric. It's an abuse of human rights. And I just wish your patients and your public would be stronger to fight against this. This is inevitable when your turn comes. So, the family were advised to sign a discharge against medical advice notice, even though she was dying. The doctor took her home. She was in a coma. She was intubated but not ventilated. She was on oxygen. And when she got home, she died within 2 hours of being at home. But at least, thank God, she had her family around her. In the meantime, she suffered 14 days, 14 times 24 hours of purgatory, of hell. So she went to hell before she died. Terrible. And this is what the doctor wrote. And note the year that it was written. 2005. 20 years ago. A highly eminent invasive cardiologist who is now working in the USA wrote this. My family and I are writing this to improve conditions in India, a final gift to our mother and our motherland. It is time to take action now, or others will undergo a similar ordeal. Every hospital should have an ethics committee, which includes physicians, nurses, and someone non-medical from the community, such as a priest or a well-respected volunteer. Nobody's listened. That's sad. He did this to help other people. He wrote this article. It's brilliant. So that's that news. So let's have some good news now. So if you decide that you don't want to go, if you want to go against the advice of going into the intensive care unit, I know that family members do it for the best intentions. Either their mother or father or auntie or whoever it is, is at the end of life, and I can show you pictures. The relatives say, please do something, do something. But actually the doctor that's looking after the patient is brilliant at oncology and everything else, but doesn't know anything about palliative care. And Dr. Sternswald used to say, when all you've got is a hammer, everything looks like a nail. So if all you've got is radiotherapy, fine, that might be great, or all you've got is chemo, or all you've got, whatever it is, then everything, you think that's the only thing that you can deal with it. But anyway, let's have a look and see what can be done. So one of the things is to make ICU more comforting, and using your imagination. So this is actually a friend of mine who was young, very, very sad. She choked on a piece of food, and she was ventilated, and she was found to be brain dead. And the intensive care unit were fantastic. This was in England. And we were able to bring in her favourite things. So that's an Indian shawl that I bought her, and another Indian cushion that she loved very much. And there were pictures of her children around the bed. So the nurses, when they looked after this lady, I don't say nurses here, sometimes we just think of our patients as numbers in a bed. Oh, she's the one who choked, she's the choke, she's the stroke, he's the cardiac. That person underneath the diagnosis has got a family, has got a name, has had a life. Anyway, this helped, although it was terribly sad that she died, obviously, but it did help, having all the things around her. We were able to put lights, etc. around the bed. And this was her. That is the person lying in the bed. And we were able to make it so when the nurses and doctors were looking after her, she wasn't just an inanimate object, she was a human being. And we were allowed in as family, 24/7. We took it in turns, just to hold her hand and to be there. If you look on this slide here, you can just see a hand here, the mum's hand. Why don't we allow relatives in? Oh, madam, they'll behave too badly. Rubbish. You get a nurse to show them what to do, you have them in one by one, and you teach them, and you support them, and you tell them about being quiet, or holding a hand, or gently whispering to the person, or singing to them, or whatever. It's up to us nurses to treat and teach the patient's relatives. So this is Dr. Raj Gopal as you look on the right-hand side, father of palliative care in India, and he's talking to Dr. Twycross, the father of palliative care in the world. And Dr. Raj Gopal was a very humble man. I remember a diploma student, and I was the director of the course that had 6 doctors on it. 6 doctors from India. And they had to learn from me, and obviously I was just part of the team, but I was, their mentor. And he was amazing. And I said to all the doctors, I want you to say one thing you're going to do when you go back to India that won't cost any money, and you don't have to get any permission from anybody. The other 5 were going to build a hospice. They were going to do all sorts of things, like, unless they were going to do it single-handedly and they had the land, they couldn't do it on their own. He said, I'm going to write "listen" above my door to remind me to listen to the patient. Because anybody who's here is medical, the patient is the best teacher. No doubt about it. And this was the humble beginnings in 1993 in Calicut, as it was called then, Kozhikode. Tiny little office he made, and he used to see an extra patient every day. And now there is a World Health Organization collaborating centre for community participation, starting originally from this tiny little room. So it can be done. It can be done. The sad thing is, which is sometimes demoralising, is that we see the end product, like the beautiful Tata Hospital, for instance. But at some point, it must have started somewhere when it was much smaller. Do you know what I mean? And I think sometimes we feel overwhelmed when we see great things and think we couldn't do it, but we can. Okay, so this is Sabir. He lost his leg amputated from a cancer. He lost his self-esteem, he lost his job, his wife left him, he had 4 children and they all went into the orphanage. He lost everything. And he was receiving 150 milligrams of morphine every 4 hours. So that's 900 milligrams in 24 hours, and he's walking up the steps. Just to give you the good news, that among the remedies which pleases Almighty God to give man to relieve his sufferings, none is so universal or so efficacious as opium. And that was written in the 1600s. A Dr. Sydenham wrote this in the 1600s. So opium is the base from which morphine is made. So it can be used safely, and it's a gift from God. So Dr. Rajgopal listens to Sabir and his worries, but what can he do? What can he do? He goes to the lions, and the lions listen, and then they roar with a great, great creativity, and they buy him a brew coffee machine. I was looking for these online. You can't buy them anymore because they're all automatic. But in those days, you had to have a person to fill the coffee up and all the rest of it. So he did that, and he earned 2 rupees per cup. And out of the 2 rupees, obviously there were expenses to be paid, but 50 paisa per cup in 1995 was a lot of money. And this was put up in Calicut Medical College, which has 1,000 patients. So let's say there are 2 visitors. So there's 2,000 people going in and out every day. He ran out of coffee. He did so well that he was soon earning enough money within 2 or 3 months to get his children back. They came out of the orphanage. His wife came back. He educated his kids. And he gave back 25% of his earnings when he was really much more wealthy to Rajgopal's clinic to help other people. And there he is, a true businessman, the power of active listening. He's now got a snack shop. So he's expanded from the brew machine. He's got 2 employees, sells samosas and bhajis and juices and everything else. This is because the doctor listened. And no, doctors can't go out buying things and doing all of this, but it's about thinking outside the box. And it's wonderful having the lions here that I know how much you do. One of my first students, actually, in 1994, was from Surat, a doctor from Surat, the Lions Hospital in Surat. You have a hospital there. And he was one of our students, and he's doing palliative care now. So the power of active listening. The power of active listening in 2016. I don't know if you'll recognise the person in the middle. That was me. So I was travelling from Trivandrum up to Mumbai, and we broke our journey in Kozhikode. And I said, what's happened to Sabir? Oh, madam, they said, he's doing really well. We'll go and get him. Anyway, in he comes on his 3-wheeler motorbike. Great. And I said, Sabir, how are you? Tell me about your family. What's happening? So he had 4 kids. They've all got qualifications, teachers, engineer, been to university. They're all married. And he's the proud grandfather of 6 grandchildren. 21 years later, after having 150 milligrams of morphine every 4 hours. And we've heard a sad story. I hear lots of sad stories. where the patients in various places that I go in India, they actually have the morphine. It's been prescribed by an oncologist, but sadly, the doctors, their own doctor doesn't allow them to take it, or the family are afraid. So we have to educate, because the drugs are there. We've got to make sure that they're used properly. So, Raj Gopal, listening. You must sit and listen to the patient. And yes, I do carry around stools with me to encourage people to sit down. Even if you're on a ward round, sit down. 3 minutes sitting, 3 minutes standing, the same time, but there's the illusion of time. I did have a video, which I can't show you, and anyway, it's in Tamil, so you wouldn't understand it, but you would have been able to see this wonderful lady, very humble, from a village somewhere, very poor. And so I was talking like I'm talking to you now, and suddenly she interrupts. And she said, and I didn't understand what she was saying. And I said, what's she saying? She says, we like it when you sit down. We don't like it when you stand up, because it makes us feel very nervous, and then we forget what we want to say. That is a teacher, as in the patient is the teacher. It doesn't matter what background they're from, they can teach us. So sitting is really important, and it doesn't take any longer. And this is a wonderful volunteer, a very old picture from 1995. The lady on the right, as you look at her, is a widow, and her son is a wonderful young man, and he had a very rare type of bone cancer. He was 23, and Dr. Raj Gopal had got his pain under control, so he came back to the clinic to work as a volunteer. But unfortunately, when he went back home, he was told that he would become a drug addict, and they wouldn't allow him to have his morphine. So the nurse, the volunteer, is just listening, but lovely posture. So this is a sadder picture. This is a patient that I saw in a hospital very far from here, nowhere near here, looking absolutely terrified, and indeed he was. And he, all around him was a bip of the machines. And the nurses walking by and ignoring him. And he was terrified because he'd watched a patient in the bed opposite be resuscitated, which is pretty frightening, to be honest. And the man was absolutely terrified. And so when I do teach, I like to go to the ward to see the patients. I want to see for myself. And we just had gupshup, an alachona, or guff, as you say, or guff, I don't know. And this was Mr. Minhas, that's his son and daughter by his bed, and we were just having a little chat, a chit-chat. And lovely gentleman, spoke very good English. His wife had died 6 months earlier. He was very sad about that, and he himself was dying, but they wanted to admit him to the intensive care unit. The power of pillows. The next day we bought him pillows, and he died peacefully a little while later, surrounded by his family in a quiet space in the ward. The power of pillows. Sometimes it's very simple things that can make all the difference. This was a lovely lady that had cerebral meningeal metastases, which were painful, but she was well controlled with her pain, and she sadly died not very long after this. But she had large doses of morphine which helped to relieve her. The way care is given can reach the most hidden parts. How do you speak to the patient? How do you examine them? Gently. How do you open the mouth? That's very painful. How do you open it? How do you feel? Gently. Gently. Patients needed to be handled like china. Like china. So this is a friend of mine, and we were teaching in the Sifla inpatient unit, Helen, who was a care of the elderly nurse, who used massage with all her patients. Her elderly patients got half an hour of massage every day. And this was a wonderful gift, and it's something you could train your volunteers to do. This is the Sifla Centre. You can see Mr. Joshi. So they've got names over the bed. So he's not the mouth, the esophagus, the breast, the leg. in bed 1, 2 or 3. He's a patient with a name. We all like to be called by name. So it's great for me, so when I go to the ward, I can say, Namaste, Mr. Joshi. My name is Julie Byrne. I'm a nurse from the UK. Sometimes I said to the nurses, could you introduce me to this patient? What's your name? Says the nurse to the patient. So we need to know our patients. I know it's difficult when you have a lot of them, but I think this thing about having a name so that you can see. And this is a lady, she took him home to die. This centre is used it has a dharamshala for the relatives, and they come in to learn how to, she did the bandage, this wonderful bandage on this gentleman's face. And she's learning how to give him a nasogastric tube feed, and learns how to care for him. And then she can take him home to die. She'll still get support from the centre if she needs it, by phone or physically. So a hospice is a place where we are the hosts and the patients are our guests. It's a place for the weary traveller. And this is the centre of the hospice. It's built around a quadrangle. It's very beautiful, very simple. There's 4 wards, all on the same level, 8-foot veranda, wide doors. The patients can be pushed in and out. And there's patients here, there's staff here, the children come and play. It's gorgeous. And I don't know, I wonder if I can get this. No, I don't think I can, which is a shame. Oh yes, I can. I don't know if you can hear. But this is the ward, the place. You can't hear the children, but it's a shame because they're making a hell of a din. That's the water. Patients sitting in the background. Kids on the swings. This is a hospice where people are living. A hospice. This is how it can be. I'm not saying you'll all be able to have these places, but, you know, it should be a place where children can come in and not be afraid. Not to be afraid. I was very lucky when my grandmother died when I was 14, which wasn't lucky, of course. But she died at home, and she stayed in the home until she was buried. And we were able to walk in and out of her room. And I believe it was a gift from God for me, because I wasn't afraid of death when I started nursing, because I'd already seen somebody who was dead, and I touched them, and it wasn't scary. Children are very resilient. They're very resilient. The gentle truth will set you free. This is a grandmother, my mother actually, aged 82. Attending her first grandchild's wedding, she had advanced cancer of the bowel with metastases. Doesn't look like it, does it? She died 5 days after this picture was taken. She'd been to the marriage and she had enjoyed herself. That's important. It's not just important for her, it was important for the granddaughter. Time is precious. Time is precious. Make sure you spend it with the right people. Make sure those of you that are young relatives that have older people that somebody's trying to get into an intensive care unit inappropriately, I'm not talking about appropriate, I'm talking about inappropriate, please don't persuade them to go in if it's really not going to make their life better. And I hear horror stories, even recently, horror stories about people who can't even go and see their mother. They can't even go and hold her hand. They've flown in from abroad to be near their mum. They can see her in the glass, and they can't hold her hand. Do you want to die like that? We need to be talking about death. We need to be talking about it and what we want when our time comes. Because we are all going to die. I'm not being miserable or depressive or anything else. It's a fact of life that we will die. But what's important is that you think now about what you want. What do you want at the end? And tell your family what you want. Because so many relatives, bless them, who are patients, just go along with what the family thinks that they want. The power of palliative care, a grandmother holding her first grandchild, days away from death. Look at her, she almost looks like the mother. She was 48. I met her 6 weeks earlier in Udaipur with Dr. Rakesh Gupta, who introduced me, and that's Dr. Bandari next to her. He's a paediatrician from Udaipur. Look at her lovely face. Does she look like a woman who's dying? No. She's living. She's holding her first grandchild, who is now 33. So when that little granddaughter, who's now a grown-up and probably got children of her own, looks at this picture, she'll know she was loved. She'll know she was loved. Guff with Queen Elizabeth. Gupshup. This is the Queen standing up with a patient from a hospice 6 weeks before the Queen died. This is the Queen 48 hours before she died, investing the new Prime Minister, Liz Truss, who luckily gave away to Rishi Sunak. I was so excited. It happened when I was in India. I was absolutely over the moon. I loved him to bits. Honestly, he was a brilliant Prime Minister. Really brilliant. Anyway, there was the Queen living 36 hours before she died. So you have a choice. You can choose. 36 hours before death, which would you choose? Being at home, with your family, doing something useful. Palliative care means we can die in the place of our choice, if that's possible. We can and need to plan ahead. We need to finish the unfinished business in our lives and die with symptoms well managed, which is not impossible, even in our own bed if circumstances permit. And this is my last story, a story of hope. So this is also from 1992, but I met, this lady is a journalist, and this is Ravi Date and his son Sami Date, and Vita, the daughter. And there's Ravi and Sami are musicians from Maharashtra. Anyway, I came back to India in 1992, and I was speaking at the Tata Memorial Hospital at a conference. And this journalist came to see me, and she put a newspaper article about me in the paper. And the next day, the wife of Mr. Singh came to see me and asked if I would go and see her husband. And I think she thought I was going to cure him. I don't know. But anyway, she wanted me to go to his home, and I did. And they came with all the notes from Tata Hospital. Obviously, I didn't have time to read them, number one thing, and I didn't know what good it would do to read them, to be very truthful. But anyway, she was there with her daughter. Her husband was a 52-year-old businessman being treated at Tata Hospital for over a period of over 6 months. And those of you that have been there know it says Tata Memorial Cancer Hospital. This is a businessman doing business with the United States and England, speaking impeccable English. He's a Punjabi gentleman, really impeccable. And he's going in and out of Tata Hospital, and his wife and daughter say, "Don't tell Papa he's got cancer." This is what happens. It's collusion. So they never talked about it. He was told no more treatment was needed. Wife Harpreet, 2 sons, Amrit, who was married and lived in the joint family, and Balbir, who was unmarried, living in Canada with his wife. And his wife was Geeta. But Geeta is a Marathi and Balbir is a Punjabi. And the parents weren't happy about the alliance, and so they went away secretly and got married and lived in Canada. But the family didn't know. They had no idea. Unmarried daughter Preeti of 26. Mr. Singh, I asked about his symptoms. His symptoms weren't too bad. His appetite was reduced. He said there's an atmosphere in the house. They're all outside the door. And then they come in. I say, "What are you talking about?" "Oh, nothing, Papa. Everything is all right." So actually that isolates him, because he knows everything's not all right, because he's heard you outside the door. And that makes patients lonely. And it makes his wife lonely. All these years they've been intimate, sharing a bed, sharing intimacy. And the time when they really need to be together, they're apart. They're apart because of collusion and lies. He couldn't manage large amounts of food, so he needed to re-educate the family. He wanted to go to Jehu Beach to pray. He was a businessman, and when he finished his day, sunset, he used to like to go off to Jehu Beach, walk and meditate and pray and do what he wanted to do. But the family had stopped that because Papa is dying. Because suddenly you get this label on your head, dying. You don't know it's on your head, but everybody else has put it there. And so they treat you in a different way. He wanted a peg of whiskey at night. I only learnt recently when I went to Amritsar that apparently Punjabis love whiskey and dancing. Whiskey and dancing. I don't like whiskey, but I did dance. He told me he hadn't slept well for 3 months. And I said, well, actually the question was, I wasn't getting anywhere with his physical symptoms, and I thought, I don't know what I'm going to do here. So I just asked him this question: how do you sleep at night? Response: not very well. What keeps you awake? Worry. What are you worried about? I'm worried I won't see my daughter married before I die. This is a man who doesn't know he's got cancer, apparently. He's 52, he's not 92. His daughter's 26, she's not 6. Do you see what I mean? In your culture, you can arrange a marriage in the space of a few weeks. Am I right? Well, it used to be that way. There's always lovely adverts in the paper. I've been looking for an advert for myself, but I can't find anybody. You know, cast no bar and all the rest of it. But we know that you can find a husband. So he knew he was dying, and they were all pretending. And that's what caused him to worry. So what's my role in all of this? Well, the family obviously weren't happy because I said I want to speak to Papa on my own. Normally what happens, the family come in with the doctor, and then the patient wants to ask something, and the family interrupt because they don't want the doctor to say anything. So the doctor's in a bind. And really the easiest way is, I don't know how I was brave enough to do it, I just said, I'm going to talk to Papa. I promise I'm not going to say, you've got cancer. I never mentioned cancer. I never mentioned, well, I did mention death, but I'll tell you how. So I didn't go in there saying that, but I wanted to know what his worries were, which he wouldn't have opened up in front of his daughter and wife. He wouldn't. Anyway, the daughter comes in, and I said to her, your Papa tells me how much he loves you. They both cried, because it's emotional, isn't it? And I said, he wants to find a husband for you. And he had been trying to have this conversation with his wife and his daughter. We'll wait, Papa, till you're better. And he knows he's not getting better. He knows he's dying. And this means he can't attend to his unfinished business of finding a husband for his daughter. It's terrible for him. It's torture. So, yes, she said. Then the wife comes in, and I said, Papa, wants to be looking for a husband for your daughter. And he also wants a peg of whiskey at night, and he wants to go to Jehu Beach. I never saw him again. So the next day, they called me to tell me that Papa had slept for the first time in 3 months. I don't know if it was the fact that he went to Jehu Beach, or that he'd had a peg of whiskey, or that he was starting to look for a husband for his daughter. Doesn't matter. He slept. I never saw the family again. But the journalist contacted me in June. I met the family in February, and she told me that he died. And of course I was sad about that. But she said it is sad, of course. But the good news is that he found a husband for his daughter, Karan, for Preeti. Active listening. I never said you're going to die. All I said was, when he said, I want to find a husband for my daughter before I die, I said, we never know when our God will take us, and that is the truth, isn't it? I mean, I could get killed on the way down the hill tomorrow. Anything might happen. Or when I used to leave my mum, and she's still alive in 92, we said our goodbyes, because I sometimes was here for 10 weeks, and I didn't know if I'd ever see her again. So we were prepared ourselves. So we never know. And if you want to do something, do it now. You've probably heard of that film called The Bucket List. Do it. Don't wait. If you can afford it, do it. So he saw his marriage, and he danced at her wedding. He had whiskey and he danced at her wedding. Isn't that wonderful? That's palliative care. That's palliative care. All those great stories I've told you. Treatment that's just going to make you worse and make your bank account even worse than that. And the best thing was that the brother, who was in Canada and secretly married to the journalist's daughter, came back, and he was brave enough to tell his brother. And the brother said, "You must ask Papa's permission to get married." And he said, "Papa, you know the girl that I love. I know she's a different caste, but I love her, and I want your blessing." And you know, when people are dying, suddenly caste, money, possessions, gold become completely unimportant. And so yes, he saw them married, and he danced at their wedding as well. 2 marriages in the space of 16 weeks. Palliative care. And if we'd lied to him and pretended that he was getting better, those children wouldn't have had their father at the marriage. And those are the grandchildren. So when they look at the wedding pictures, who's that? That's Grandpapa. He's dancing, he's dancing. Why isn't he in here now? Well, sadly, Grandpapa died. What did he die of? Well, he had cancer. He had cancer and he could still dance. So you're training the next generation that cancer is not gloom and doom. I had breast cancer. I was diagnosed last year. Luckily, all my doctors were from India, and my radiotherapist was from Tata Memorial. And it was great. I was so excited to be treated by Indian doctors. You know, I'm fine now. I'm absolutely fine. But we have to live our lives and not be afraid. And I think it's up to us to support patients and their families. So thank you. Thank you very much for listening, and good luck with all your work.